Addiction is a silent destroyer. It creeps into the brain, the body, and even the soul. Whether it's alcohol, drugs, pornography, or gaming, every addiction rewires the brain and harms the organs that keep us alive. Alcohol in particular leaves a trail of damage across the body, from the liver and heart to the brain and nervous system. In this video, we'll uncover how alcohol slowly weakens vital organs, why the damage often goes unnoticed until it's too late, and how understanding these effects can help us break free from the grip of addiction. Because knowledge is the first step toward recovery. Alcohol has one of its most devastating effects on the liver, the primary organ responsible for detoxifying harmful substances in the body. When a person consumes alcohol, the liver immediately begins breaking it down using enzymes. Small amounts may not overwhelm the system, but with repeated and heavy drinking, the liver becomes overworked. Alcohol is toxic to liver cells, and over time, this toxicity leads to structural damage and impaired function. The first stage often seen is fatty liver, where fat builds up inside liver cells due to the disruption of normal metabolism. Although reversible with abstinence, fatty liver is a warning sign that the organ is under strain. With continued drinking, fatty liver can progress to alcoholic hepatitis, an inflammatory condition where liver cells become swollen, irritated, and damaged. Symptoms may include abdominal pain, nausea, jaundice, and fever. Some cases are mild, but severe alcoholic hepatitis can be life-threatening and requires urgent medical care. The inflammation damages liver tissue further and sets the stage for scar tissue to develop. Over years of heavy alcohol use, scar tissue begins to replace healthy liver tissue in a process known as fibrosis. The liver, normally soft and flexible, becomes hardened and less able to function. Fibrosis reduces blood flow through the liver and interferes with its ability to filter toxins, produce proteins, and regulate metabolism. If alcohol use continues unchecked, fibrosis often progresses to cirrhosis, the most advanced form of alcohol-related liver disease. Cirrhosis is irreversible and characterized by widespread scarring, nodules, and loss of functional liver cells. At this stage, the organ is severely damaged, and complications such as ascites fluid buildup in the abdomen, variceal bleeding, hepatic encephalopathy confusion due to toxin buildup in the brain, and liver cancer may develop. The impact of alcohol on the liver is not limited to chronic heavy drinkers alone. Even moderate but regular drinking can stress the liver, especially when combined with other risk factors such as obesity, hepatitis infection, or certain medications. Genetics also play a role, as some individuals are more vulnerable to alcohol-induced liver damage than others. The frightening reality is that the liver can be silently damaged for years without obvious symptoms, and many people only discover the severity of the problem once significant disease has developed. From a medical perspective, the encouraging fact is that the liver is remarkably resilient in its early stages of damage. Fatty liver and even mild alcoholic hepatitis can improve significantly if alcohol use stops and healthy lifestyle choices are adopted. Nutrition, hydration, and medical supervision can support healing. However, once cirrhosis is established, the damage cannot be reversed, and the focus shifts to managing symptoms and preventing further decline. For some patients, liver transplantation becomes the only life-saving option. In summary, alcohol's toxic effect on the liver is one of the clearest demonstrations of how addiction damages the body. What begins as fat accumulation can end in cirrhosis and life-threatening complications if unchecked. Protecting the liver means respecting its limits, recognizing early warning signs, and most importantly, reducing or eliminating alcohol intake before irreversible damage occurs. Alcohol has significant effects on the heart and the entire cardiovascular system. And while some people believe that small amounts of alcohol may have protective effects, the reality is that excessive and prolonged consumption damages the heart in multiple ways. One of the most immediate consequences of heavy drinking is an increase in blood pressure. Alcohol raises the release of certain hormones that tighten blood vessels and increase the workload on the heart. Chronic high blood pressure or hypertension strains the arteries, weakens their walls, and greatly raises the risk of stroke, heart attack, and kidney disease. Another damaging effect of alcohol is on heart rhythm. Many heavy drinkers experience irregular heartbeats, a condition known as arrhythmia. Binge drinking, even in people who do not drink daily, can cause holiday heart syndrome, where the heart suddenly beats irregularly after an episode of heavy drinking. These arrhythmias can range from palpitations and dizziness to more dangerous rhythms that compromise blood circulation, and, in severe cases, can lead to sudden cardiac arrest. Over time, alcohol also weakens the actual muscle of the heart. This condition, known as alcoholic cardiomyopathy, results when alcohol interferes with the way heart muscle cells generate energy and contract. The muscle becomes enlarged, weakened, and less efficient at pumping blood. As the heart loses its ability to pump effectively, fluid begins to back up into the lungs, legs, and abdomen, leading to symptoms of heart failure such as shortness of breath, swelling, and fatigue. Alcoholic cardiomyopathy is often progressive and, if not addressed early, may result in permanent disability or death. Alcohol's impact on cholesterol and fat metabolism also plays a role in cardiovascular disease. Excessive drinking contributes to weight gain and increases triglyceride levels, a type of fat in the blood. High triglycerides are a risk factor for atherosclerosis, where fatty deposits build up in arteries and restrict blood flow. Combined with high blood pressure, this narrowing of arteries raises the risk of heart attacks and strokes significantly. Alcohol can also interfere with medications prescribed for blood pressure, heart disease, or clot prevention, making management of these conditions more difficult. It is important to note that alcohol's cardiovascular effects are not limited to long-term drinkers. Even short-term excessive consumption can trigger severe consequences. For example, binge drinking can sharply elevate blood pressure or cause clotting abnormalities, increasing the immediate risk of stroke. People who already have underlying heart conditions are especially vulnerable, as alcohol can destabilize an already fragile cardiovascular system. From a medical perspective, moderation and early intervention are key. Reducing alcohol intake, adopting a healthy diet, exercising, and managing stress can help reverse early changes in blood pressure and rhythm. However, once the heart muscle is significantly weakened or enlarged, recovery becomes more difficult. Treatment often involves medications to support heart function, and in advanced cases, the damage may be irreversible. In summary, alcohol places a heavy burden on the cardiovascular system through high blood pressure, arrhythmias, weakening of the heart muscle, and acceleration of artery disease. What may begin as occasional heavy drinking can, over time, culminate in life-threatening conditions such as heart failure, stroke, or sudden cardiac death. Protecting the heart requires understanding these risks and making conscious choices to limit or avoid alcohol before its effects become permanent. Alcohol has a profound impact on the digestive system and the pancreas, organs that play essential roles in processing food, absorbing nutrients, and maintaining overall health. When alcohol enters the body, it begins irritating the lining of the digestive tract almost immediately. The stomach lining, in particular, is sensitive to alcohol's corrosive nature. With repeated exposure, the protective mucus barrier in the stomach weakens, allowing acid to irritate and inflame the tissue. This often results in gastritis, a painful condition characterized by nausea, vomiting, abdominal pain, and, in severe cases, bleeding ulcers. Alcohol also disrupts the natural movement of food through the digestive system. It can slow down muscle contractions in the esophagus and intestines, leading to reflux, indigestion, or constipation. At the same time, it weakens the sphincter between the esophagus and the stomach, increasing the risk of acid reflux. Chronic acid exposure not only causes discomfort, but also damages the esophageal lining, raising the risk of esophageal cancer. Another major consequence of heavy alcohol use is malabsorption of nutrients. Alcohol interferes with the small intestine's ability to absorb vitamins and minerals effectively, particularly B vitamins such as thiamine, folate, and vitamin B12. These deficiencies can contribute to a weakened immune system, anemia, neurological problems, and delayed healing. People who drink heavily may eat less or choose poor diets, further compounding malnutrition. Over time, this nutritional imbalance worsens overall health and accelerates organ damage. The pancreas, a critical organ for both digestion and blood sugar regulation, is especially vulnerable to alcohol. Alcohol triggers the pancreas to secrete digestive enzymes prematurely, which can cause the enzymes to attack the pancreas itself rather than food in the intestines. This self-digestion leads to pancreatitis, a severe and painful inflammation of the pancreas. Acute pancreatitis can cause intense abdominal pain, vomiting, fever, and can even be life-threatening if complications such as infection or organ failure develop. Repeated bouts of acute pancreatitis often progress to chronic pancreatitis, where the organ becomes scarred and permanently damaged. Chronic pancreatitis is particularly devastating because it not only impairs digestion, but also destroys the insulin, producing cells in the pancreas. This leads to diabetes, further complicating a person's health and making management of nutrition and energy balance even more difficult. Alcohol-induced pancreatitis is one of the leading causes of long-term digestive failure and can severely shorten life expectancy if drinking continues. In addition to these direct effects, alcohol also contributes to cancers of the digestive system. Repeated irritation, malnutrition, and inflammation increase the risk of cancers in the stomach, pancreas, liver, and intestines. The combination of toxic exposure and weakened immunity leaves the digestive tract vulnerable to long-term, often fatal diseases. From a medical standpoint, many of the early digestive issues caused by alcohol, such as gastritis or mild nutrient deficiencies, can be reversed if drinking stops and proper nutrition is restored. However, conditions like chronic pancreatitis or digestive tract cancers are irreversible and often life-threatening. This makes early recognition and intervention critical. In summary, alcohol severely compromises the digestive system and pancreas, beginning with irritation and reflux, progressing to malabsorption and nutritional deficiencies, and ultimately leading to pancreatitis, diabetes, and cancer. These effects highlight that alcohol is not only harmful to the brain and liver, but also to the very system that sustains and nourishes the body. Limiting or eliminating alcohol use is essential to protect these vital organs from irreversible damage. Alcohol exerts a profound and damaging influence on the brain and nervous system, making it one of the most concerning effects of long-term drinking. When alcohol enters the bloodstream, it crosses the blood-brain barrier quickly, altering the way neurons communicate. Neurotransmitters such as gamma-aminobutyric acid GABA and glutamate are particularly affected. Alcohol enhances GABA, which slows brain activity, and suppresses glutamate, which is responsible for excitatory signals. This dual effect produces the initial feelings of relaxation and lowered inhibitions. However, as drinking continues, it also impairs coordination, slows reflexes, and diminishes judgment, increasing the likelihood of risky behaviors and accidents. In the short term, alcohol also disrupts memory formation. Many drinkers experience blackouts, which occur when the brain's hippocampus is unable to properly store information due to alcohol's interference. This results in partial or complete memory loss for events that occurred while intoxicated. While occasional blackouts may seem harmless, they signal serious neurochemical disruption, and repeated episodes can cause long-lasting cognitive damage. Over the long term, chronic alcohol use leads to structural and functional damage in the brain. Prolonged exposure causes brain shrinkage, especially in areas responsible for learning, memory, and emotional regulation. This damage manifests as poor concentration, difficulty in decision making, and emotional instability. Many individuals develop anxiety, depression, or mood swings directly linked to alcohol's neurotoxic effects. Furthermore, alcohol affects the cerebellum, a part of the brain essential for balance and coordination. Damage to this area can result in tremors, unsteady gait, and permanent loss of fine motor skills. Alcohol's impact extends beyond the brain to the peripheral nervous system. Nerve cells outside the brain and spinal cord can be damaged in a condition known as alcoholic neuropathy. This condition is caused both by the toxic effects of alcohol and by deficiencies in essential vitamins such as thiamine, which alcohol depletes. Symptoms of neuropathy include numbness, tingling, burning sensations, and muscle weakness, often beginning in the hands and feet. Over time, it can progress to significant pain, difficulty walking, and loss of independence. One of the most severe neurological consequences of alcohol abuse is Wernicke-Korsakoff syndrome, often referred to as alcoholic dementia. This disorder is caused by a deficiency of thiamine vitamin B1, which is vital for brain metabolism. Wernicke's encephalopathy presents with confusion, loss of muscle coordination, and vision problems, while Korsakoff's psychosis leads to profound memory loss, confabulation making up stories to fill memory gaps, and irreversible cognitive decline. This condition highlights how alcohol not only directly damages the brain, but also depletes nutrients essential for its survival. The nervous system damage caused by alcohol is not limited to those who drink heavily every day. Even repeated binge drinking episodes can cause neuronal injury, especially in young people whose brains are still developing. Adolescents and young adults who drink excessively risk impairing brain growth, which can have lifelong effects on intelligence, impulse control, and emotional regulation. From a medical perspective, the good news is that some of alcohol's effects on the brain are reversible if drinking stops early enough. Improvements in memory, concentration, and mood can be seen within months of sobriety. However, once permanent brain damage or neuropathy develops, the damage cannot be undone. At that stage, treatment focuses on managing symptoms and preventing further decline. In summary, alcohol's assault on the brain and nervous system ranges from short-term impairment in judgment and memory to long-term neurological diseases and irreversible damage. The brain, being the control center of the entire body, is especially vulnerable, and every drink carries the risk of disrupting its delicate balance. Protecting the brain and nerves means limiting or eliminating alcohol use before the damage becomes permanent. Whether it is to alcohol, drugs, pornography, gaming, or any other harmful behavior, is not a path to relief but a road to destruction. The body and mind are gifts that must be protected, not poisoned. If you or someone you love is caught in the grip of addiction, seek help today. Change is possible, recovery is real, and the earlier you act, the more you can save. Let us stand together against addiction and choose life, health, and freedom over temporary escape.